Hey guys, Dr. Ben here, FA Well Centers. Super excited to bring on today Dr. Chris Steiner, and he is one of our F8 doctors at the Hendersonville, Tennessee location. Welcome, Dr. Chris. How's your day going so far?
Fantastic. How about yours, Ben?
Yeah, we're getting going here. So I wanted to bring you on specifically because we're going to be talking about the brain. We're going to be talking about doing brain maps as well as the actual neurofeedback, which is the brain treatment that we do with patients. We're going to be taking questions. So if you guys have any questions at all in regards to the brain, in regards to how you can help with insomnia, anxiety, depression, focus, brain fog, all these things, bring your questions. Pop down below where you guys are watching from. Love to see you. But this tool, this technique, it's been around for a long time, hasn't it?
Yeah, actually, NASA had first developed it so astronauts go into space.
Yeah, and
Been
that
around
was
since the
back,
late 50s.
what, in the 1970s, right?
Well, that's when they got more into the clinical aspect of it. But
Yeah.
it was actually developed back in the 50s and early 60s, like I said, with NASA. But you needed a supercomputer to do what we do with with a cell phone today.
Yeah.
Back then. So
Yeah,
now,
those computers would fill an entire warehouse. But here's the fun part. When we start thinking about the brain, you can't separate the two. In functional medicine, and you've seen this for years, being in the field for over 20 years, like I have. You've seen it where people like get into it and go, "Oh, hey, let's give you a supplement. Let's change your diet. Let's do a detox. Hey, Megan, good to see you. Constant brain fog, no energy, tired." We're going to be talking about that, so stick with us here. So you see all this metabolic work, we'll call it, but what gets left to the wayside is the brain. What are some of the things that you've seen, just working with F8, where you're like, man, if all I was giving somebody a supplement, no way we have gotten the results without changing the brain.
well, as you've talked about many times, our GI tract is our secondary brain. So if we have a problem in our GI tract, we're also going to have a problem in our brain. That's why we check the vagus nerve when people come in for an exam and do the old gag reflex. They don't work hand in hand. So exactly like what you're saying, if we just give a supplement, we're only doing it halfway. The body, we want to look at the person as a whole being from head to toe, not just, ooh, you got a thyroid issue, and we're going to ignore your gut function and your leaky gut or whatever's going on, or your dysfunction in your nervous system. Because the brain, this is why I love dealing with functional neurology, is the brain controls every cell in the body. I can't tell you how many people we would help with neurology. It's countless. And people with neurofeedback, I'm sorry, it is so much fun. People who've tried 20, 30, 40 other things, and now they're getting results. And that's why I love this little acronym I got up here. A bad brain. Well, what is a bad brain? Well, let's start at the top. A bad brain is, brain fog. You start the B right up the top there, brain fog.
Yeah, let's look at this one. Megan typed in constantly brain fog, no energy, tired. That is a very common thing. And here's the deal, Chris. We just did a video on this earlier this week on about COVID and COVID long haul and how so many people now are dealing with brain fog post COVID, and it's a legit thing. And if you we did a little post last week on what symptoms are you having post COVID. There was like 400 comments, and a lot of those were about brain fog. You want to explain a little bit what brain fog is? Some people may not be familiar with that term.
Yeah, brain fog, for a generic term, is people like you lose your car keys. You walk in a room, forget why. Like, what am I doing? You lose your train of thought. You're in a conversation, you get a tiny little bit distracted, and you can't remember where you were in that
Sticky
conversation.
notes everywhere.
Yeah, sticky notes everywhere, all over the computer screen, keeping yourself up to date on things. That is what we see with people. And they go, oh, I'm just getting older. No, you're not just getting older. That is not normal functioning. Because remember, the brain needs two things to function. It needs fuel and activation. Fuel being proper glucose. That is why we deal with, you wrote the book on blood sugar doesn't lie. And also oxygen. That's why we check the oxygen levels when you come into the office. For the brain to function optimally, we need to be no less than 97% oxygen concentration. So cardiology
on the pulse ox.
Yeah, on the pulse ox, can't have anything less than 97. Otherwise, you're not getting enough fuel to the brain. The brain is the most metabolically demanding organ in the body. So what that means in layman's terms, it uses a lot of fuel. So remember you took hard tests in school like the SATs, or we were studying for boards in chiropractic school. You're exhausted after you take the test, but you just sat there for 2 hours. But your brain is using lots of glucose, lots of fuel for the body. So it is the most metabolically demanding organ, like I said. So we need to do the metabolic aspect along with the neurological aspect to get the whole complete person to get their life back.
And that's really, when we look at our 4 offices around the country, and we're going to be bringing more, hopefully, to a location close to one of you guys out there. And, it's one of the reasons every one of our offices, yes, we're doing functional medicine. We're changing the metabolic state. We're reversing MS and Crohn's disease and all these issues. And yet every single office has neurofeedback in there. It'd be way easier to not have to do a brain map, to not have to do neurofeedback, just to give somebody some pills and go on their way. But it doesn't work that way. And, some people will get changes, but so many times we see patients come in and they've been to this doctor and that one and her and him and all these different people and tried, a Lyme test and did this other mold protocol or all these different things. But the one thing they did not address was between their 2 ears. And, give me some examples. I always say, Dr. Steiner, he has done more brain maps than any other doctor in the country. Literally, he's been doing this for 15 years, and in his old office, he used to actually work in Denver. And he would do all the brain maps, and has done literally thousands and thousands of brain maps. And so, give us some examples, some stories of where people, once they address that brain side, boom, the lights turned on, and all these metabolic issues started going away too.
Yeah, no, and that's why I said the brain controls every cell in the body, and it is critically important to make sure we activate it and stimulate it appropriately. And that is why I love neurofeedback. I wish I had it when I was a kid. It would have made my life so much easier. It would have saved me 20 years of heartache.
What were you, the little ADD kid there?
I was, typical boy.
You were spinning circles and.
Yep. I'll give you a quick story. In 4th grade, I'll never forget it. They didn't know what to do with me. They had my hearing tested. They had my vision tested. They didn't know what the heck to do. And this is in the 70s, mid 70s. So it was a different time. And I'll never forget, one week on Monday, I was in the regular class. On Tuesday, I was in the remedial special ed class. They used a different term for it back then. On Wednesday, back in the regular class. Thursday, I'm in the gifted accelerated class. And then Friday, back in regular class. So they weren't sure if I was Einstein or Forrest Gump. So
probably a little bit of both, right?
Yeah, definitely. But I tell people all the time, the only way I got through school, because if you asked me in high school, Chris, you're gonna be a doctor? No way in heck am I going to school for 100 years, man. I hated school. I did not fit into the classroom mold. I love learning, and now I teach neurology, and it's so much fun. But I had to work 10 times harder than all my friends. So I wish I had neurofeedback. So I use neurofeedback on myself. I use it on my kids. It's a great tool. You asked a question before about some examples. I've got a couple of pages that always stand out in my life. I had this one kid come in, gentleman, 32 years of age. When he was 19 years old, he had half of his brain surgically removed. And basically, he was paralyzed on the right side of his body. And if he said hello to him, he would say hi, and it would take him 10 seconds to communicate back. It would be a 10-second pause, and then he'd go, hey, like Frankenstein. I'm like, man, that's not the way to live. And I didn't know if we were going to help him, but this is the power of your nervous system. Even though, for the most part, this part of your brain controls this part of your body, there is still connections on every aspect of your brain. And that's why I love neurofeedback. It creates neuroplasticity. Neuroplasticity is the formation of new and stronger connections in your nervous system, particularly in your brain. So amazing things happen. We did our protocol. We did our systems. We worked with him. I did some other neurological stimulations with him as well. And I'll never forget it. On the video testimonial, he comes in. And remember, he had a splint on his leg to help him for foot drop. His hand was all contractured up. And I go, how you doing, buddy? He goes, man, I'm doing great. I go, remember what brought you into the office? He goes, yeah, I was hoping you could help me with my plantar fasciitis. And you can see me looking at him like, what are you talking about?
Plantar fasciitis, for those of you who don't know, that's a foot issue, not a brain issue.
Yeah. And it's like, no, you couldn't talk. You could barely walk. You couldn't move your hands. And And I go, remember the comm lag you had? He goes, yeah. I go, how's that now? He goes, I don't have one. It was great. And now I'm friends with him on Facebook. And this is about 7 years ago. Before COVID, he started traveling the world. He was miserable. He was living in his parents' house, 32 years of age, never thought he was going to have a girlfriend or anything like that. He's a great young gentleman. And, but the best part was when he finished care, a lot of patients like to give you gifts, right, Dr. Ben?
Oh, yeah.
Because they're so grateful. The best gift I ever got was from this gentleman in terms of he took a pottery class and he made my staff and I coffee mugs.
And he could actually sit there and mold it the way he wanted to.
Yeah, it was just absolutely amazing. And
I mean, what a crazy story. And I've got so many of these as well, where a little 5-year-old girl that couldn't communicate, couldn't even stand up, had limp body. Within weeks of starting neurofeedback, was able to stand, was able to start doing more therapy, was able to get in the pool and do rehab, all these different things. So this is the really great part about doing the brain map and then doing neurofeedback, is that it's not just for people that are having these major issues. We have 38-year-old women, moms that have anxiety and insomnia, and they can't sleep, and they're just not the best mom they can be, and they come in and have miraculous changes. I've had CEOs, I've had head coaches at the local university, really, I'll call them high-end brains, and yet it's everybody. And so let's unpackage this a little bit. And again, pop questions down below. We're going to get to those in a few minutes here, guys. So stick with us. Pop questions down below. Any of those questions we're going to get to. And again, if you have not liked or followed our page already, go ahead and hit that button. And then there's a little bell up top, and you will be notified. And when you hit that one, you'll be notified anytime we go live. If you're not on Facebook much, jump onto YouTube. You can search our 600 videos on there and subscribe to that one. And we post all of our videos. So even if you're not on Facebook a lot, you can jump onto YouTube and check all of our videos. We have a lot more about neurofeedback, about the brain. Get in there and learn. So where do we start? When a patient comes in, where does the process start to evaluate their brain?
Well, the first thing starts off with our exam. We do the neurological exam, and then also we do perform what's called a quantitative EEG. I like to call it a brain map for short. It's a lot easier. And what that entails is we put a nice little EEG cap on your head, and we're going to read the electrical output that's created by your brain. I don't know if most people are aware, but your brain makes enough electricity to turn on a 30-watt light bulb. So just like
you can plug it in, you can power a toaster.
Yeah. So Uncle Fester was right. Put the old light bulb in his mouth and to turn it on. The old Addams Family joke there. But the point being is, our body has a lot of electricity in it. Our nervous system is an electrical system. That is why so many of these medications might work short term, but not for the long term for chronic illnesses. We have to activate, stimulate, get that nervous system turned back on. Like I said before, you have fuel and activation. The fuel is oxygen and proper glucose, and then the activation is the actual stimulation to the nervous system. Because if you don't use it, you lose it. But that's another thing I love about neurofeedback.
One of my favorite studies, Chris, so Dr. Steiner, one of my favorite studies is where they compared neurofeedback to Ritalin with ADD kids. And they both decreased the amount of ADD, the amount of lack of focus, and whether they were getting in trouble in class or whatever, but they both of them decreased it. The cool part with this study was that they stopped each one. So they stopped doing neurofeedback and they stopped giving them Ritalin for 6 months. And what happened was the kids that were doing Ritalin, they went right back to the symptoms that they were having before, where the ones that had done the neurofeedback, they maintained their changes. And this is the beautiful part. I always say, unless somebody has death, divorce, trauma, drama, head injury, some major thing, it could set the brain back a little bit. But 98% of the patients don't need to do neurofeedback again. We're able to have pretty much permanent changes when somebody goes through this process. So their brain calms down. So many people, I just had a patient that I saw yesterday, and he's a nurse and in charge of like 30 employees. And I mean, he took the day off yesterday because he broke down and he was in tears at his breakfast table. You know, his kids were coming up and consoling him. Dad, you're going to be okay. You got this, Dad. And it was, you know, just so much. And so we're doing a brain map today, and we're going to figure out which waves are out of balance. You know, and if you were just guessing, Dr. Steiner, you know, somebody like that, which wave? And this is the cool part with the brain map, is you can tell based off the brainwave pattern which brainwave pattern is related to that anxiety and worry and revved up and all that.
His alpha, I wouldn't be surprised if it's through the roof.
Yeah. So that alpha, just like, do you do yoga, Dr. Steiner?
No, I'm more of a weight guy.
So that Dr. Steiner played football. He's a little bigger than he looks right here. So yeah, I didn't figure you'd put your foot behind your head. But at the end of yoga, when anybody that's done it, when you lie down and they say don't think about anything, and you really do that and don't think about anything, you're in the alpha state. And that is actually a really healing state. That's what mindfulness is all about. There's a lot of healing that goes on in the body when you're in that alpha state. But what happens in that brain map, if that alpha is really high, that's going to be anxiety, worry, rumination, hyper-emotionality, can't shut it down. And so here's the thing. We've been talking a lot about autoimmune this week. And almost every single autoimmune patient that we work on is going to be dealing with a high alpha, and it's going to keep their immune system in this revved up state, this chronic fight or flight. And this is where that neurology and that metabolic work have to go hand in hand for a lot of these different cases.
Yeah, definitely. I mean, we tell patients all the time, because this is why we're so successful in helping people. We're looking at them as the whole person, getting a full rounded aspect. I always go back to the old wagon wheel, and the old wagon headed out west, right? You don't just have one spoke in that wagon wheel. You have 8 to 10 spokes in there, and you have to address every single issue, not just one tiny issue. I wish we had the magic wand and you just, everything's perfect.
And give you that one pill.
Yeah, here's that magic pill. But that's not the way the human body works.
No. So tell me, does the brain map, you know, so that's where we're going to actually evaluate the different brainwave patterns. Does that hurt? Are you adding anything into the brain? What's going on there?
No, it is completely external, just like an EKG of your heart. So we put leads on your heart. Everyone's seen the little EKG boop, 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 on TV shows and stuff like that. Well, it's the same thing with your brain. We're going to put a cap on your head. It is completely safe. There is nothing being put into your body. Even when we're doing the therapy, the actual neurofeedback therapy, nothing's being put in your body, but I'll get to that in a minute. So the cap is real simple, and it just measures the electrical output created by your brain. And your brainwave patterns, nice little squiggly lines, kind of like the EKG that we're watching. And then we get a nice little report that shows the nice picture of the brain and shows if it's going too fast, how many standard deviations out of balance going fast or slow. I usually like to use the term allowance fast and slow. People understand that more. Or if it's just right, kind of like Goldilocks, the porridge is too hot, too cold, or this one's just right, and that's where we want to get you.
Let's look at a couple questions here. So, what causes frequent dizziness in a diabetic? Well, diabetics are going to be dealing with, even though they have high glucose, which Dr. Steiner was talking about, the brain needs oxygen and it needs glucose for fuel, but even high glucose, you're not getting that glucose into the brain. And so there's a very good chance that blood sugar is high, but it's not getting into the brain like it needs to. And that could be part.
Can't hear you.
Can you hear me?
Yep.
Okay, great. So glucose not getting to the brain, as well as it could be an oxygen issue. We see this all the time. That blood pressure goes up when the glucose and diabetes goes up. All these. I have a patient yesterday, just talking to him. He's down 10, 15 pounds already in about a month and a half. And his blood sugar is way more stabilized, but his blood pressure came down 20 points. They just redid his cholesterol, starting to change change. All these things are starting to shift. So I would definitely start on that blood sugar side. Melonia watching from Ghana. Good to see you in Ghana. Eula in Michigan. Hello to you. Elizabeth in Nebraska. And Lou, some brain fog. Okay, Stacy, great question. And I'll let you take this one, Dr. Steiner. How do you do neurofeedback remotely? So, I mean, you get patients you're in the Nashville Metroplex, you get patients from Kentucky, Missouri, Arkansas, Mississippi, where else? North Carolina, South Carolina?
Yep, no, South Carolina. We just had somebody come down from Pennsylvania last week. We have people today in Maryland coming in. So people come in and we take care of it. So how do we do it remotely? That's a great question. The most important part is we have to do the brain map first. That would have to be done here in the office. But we're lucky enough, we have these great tools called home units. So we're able to do the therapy remotely. We give you a nice little unit, you take it home, and you use it at home. And the home unit thing is great because you're able to do the therapy at home. Now, is it on the same level as when you come here and use our big professional units? No, of course not. But you're able to do it every single day, so you're able to get the same effect because on average, they say you need about 2 or 3 home sessions to equal 1 session here in the office with the professional units. But if you get it at home, it only takes 20 minutes. You put on the headphones, you put on the glasses, you sit there, you relax for a little bit, and you're getting your brain trained, getting it going in the right patterns, the way we want it to, get it stimulated appropriately. That is the key. I had a great gentleman come in years ago. He had a stroke 5 years before he came to see me. And he spent 2 years in an inpatient rehab center. He couldn't walk, couldn't talk, and he did speech therapy, occupational therapy, physical therapy every single day. And they just couldn't get any results with this poor gentleman. We started doing neurofeedback, and it was great. I had 3 doctors in my office that day observing me and learning from me. And this was his 4th day in the session, 4th day of doing neurofeedback. And I have video of him walking out of his wheelchair that he was stuck in for 5 years. And
Nice.
yeah, it's
awesome.
These are the things that make you get out of bed every day, get up early and study how to help people.
And you've got some extreme stories, and we've seen it as well, and yet it's the little things also. I've got in North Platte, Nebraska, middle of Nebraska, small town. This kid lived on a ranch an hour outside of town. He was getting C's and D's. They drove over here about 5 hours, got their brain map, blood work, all those things done, and we got him a home unit. He started using that on that hour drive to school, hour drive home. And by the end of that year, he had actually transferred to the local Catholic school, went from C's and D's, was able to get A's and B's, and was able to go to college, take that the farming degree that he wanted to, and get that ag degree so that he could go back and make the ranch more effective. All these different things, and we'll see that with insomnia. The guy that I was just telling about that his blood pressure went down 20 points. He's gone from 4 hours of sleep a night. Can you imagine 4 hours? I'd about rather die than that. And he's up to 6 now in about a month and a half. And he's got a home unit. He's using it every day, and it's starting to make that shift. And he actually feels like a human now, as opposed to 4 hours. You don't really feel alive at that point.
Yeah, no, very few people can survive on 4 hours, and it's just not healthy for the body to begin with. But we talked about before, these are extreme cases, and I just want to show the power of the nervous system. But I've had countless patients. Everybody knows who Russell Wilson is, the quarterback now for the Denver Broncos.
For the Broncos.
So for years, he's done neurofeedback, and he credits his ability to win the Super Bowl and be a high-level achiever. Even though he wasn't drafted to the 3rd round, they said he didn't have all the talent. He wasn't a big-time Peyton Manning type player, but he credited neurofeedback of being able to keep his body functioning and his brain functioning, so he's able to be a better athlete. I've had a gentleman I want to be when I grow up. This gentleman, he came to my office. He was, I think, 78 years old. He retired 3 times. They kept pulling him out of retirement because he was so smart. But he goes, Chris, I'm losing everything. He goes, I literally parked my car. I thought I parked my car, but I didn't put the car in park, and it rolled down and hit a tree. He had a nice big piece of property, a nice ranch out in Colorado. And I'm like, okay, we'll call him John. John, this is what we're going to do. And we started doing neurofeedback, and he used to call it his super therapy. because he was able to work hard, better and smarter, and work less, which was key because he already had the gift of being a high performer. But at 78 years old, he did some damage to his body and had some concussions, and we were able to rehabilitate that. And he was loving life, and he was just a great gentleman. And these are all aspects of people we can help with. So, like I said before, neurofeedback. I have many tools that I've used over the course of my career here. 24 years of being a doctor, and neurofeedback is, I got to say, if not the most special tool in my heart, because it's so powerful and helps so many people. It's that is just amazing. I just love it. So yeah. So if you can see the little thing of bad brain behind me, brain fog. People have brain fog, anxiety, depression, bowel and bladder. That's how it works hand in hand with the functional medicine that we do. Retention, agnosgosmia. That means having a problem you don't even know you have. And those are some of the things that we find when we do our exam. People don't know they have sensory disorders, and we get that. So if you have nerve pain too, this is the key of doing both neurological and the functional medicine aspect of your care.
Awesome. All right, I'm going to have to jump here, Dr. Steiner. Tell everybody, just a 30-second synopsis of the brain map of neurofeedback, and how simple and easy it is, whether you're in office or remote, and just what a blessing it is to everybody.
Yeah, it's a non-invasive treatment, which is awesome and wonderful. Literally, nothing is being put into your body, even when we're doing the therapy. So like we said, we do the brain map, we put the cap on your head, it's reading electrical activity created by your brain. When we do the therapy, it's the same thing. We put leads on your forehead at different aspects of your brain, depending on which lobe we're trying to work on. And nothing is being put into your body. Your body is actually in full control. Your brain is telling the computer what's going on, and the computer is just responding. And you're going to sit in a nice, comfortable chair, watching a TV show, watching a movie. And every time you have an abnormal brainwave, either too fast or too slow, the movie's going to flicker and the sound's going to go out as well. So your body is going, oh, now this is where I really sound like a New Yorker, Dr. Ben. Your brain's going to go, oh, I'm watching this here. And, it wants to go back into the normal ranges. And that's how your body gets retrained through operant conditioning to go back into its normal ranges. So it's safe, effective, and it's wonderful. Literally, in over 50 years, 0 side effects have been reported to the FDA with neurofeedback. So it is a wonderful, great tool. I love it. And that's why I do it. If it wasn't effective, I wouldn't do it. I don't want to waste my time with it. So I just love it very, very much.
Awesome. So yes, thank you so much, Dr. Steiner, for being on. Truly appreciate just your knowledge, your wisdom of almost 25 years in practice now. And if you or a loved one, easy, within 8 hours, drive into one of our offices, Denver, Fort Collins, Colorado. We're in the Tennessee area as well. If you're going down to Nashville for a vacation or coming out to Denver, whatever, use that time, pop in, get a brain map done, get an exam, do blood work, and we can figure out what is truly going on inside of your brain. If you don't have the ability to get to one of those facilities, but still need help, let us know. We can work remotely with patients all over the country. It started with a lady in Canada last week. So we're excited to get this technology out to the masses and supercharge the brain. So have a great day, Dr. Steiner. Everybody else, make it a good one.
Thank you.